So I'm going to give you an example of a systematic review and how it can be useful. And this is something that actually I published recently, and we wanted to look at which of the minor phytocannabinoids had a promise in any kind of neurological disorders. So what novel phytocannabinoids have promising neuroprotective potential? And so in order to do that, we had to come up with a methodology. And so we chose the search terms. We listed all of the minor phytocannabinoids that we know exist. We listed all of the different types of neurological disorders and models that they could have been tested in. And we searched several different databases to find all of the relevant literature that could potentially pertain to those questions. And in the end, we came up with 28 studies that had looked at phytocannabinoids other than CBD and THC, because we know an awful lot about them already, but looking at the other phytocannabinoids and whether or not they have a therapeutic potential in different types of neurological disorders. And what we were able to do with that data then was to create some kind of synthesis. So we put the data all together into something really useful to other researchers. And we came up with a table. This is how we thought the data was best presented. So we listed each of the phytocannabinoids across the top, and then the different types of neurological conditions in the columns, and then just which phytocannabinoids have been tested and were successful in which conditions. And if somebody had looked at the science behind that, what was the mechanism of action of that particular phytocannabinoid in that particular disorder, then we included that information. So what we've created there in that table is really a one-stop shop for anybody who's interested in minor phytocannabinoids and their role in neurological disorders. This table tells them to date which ones are effective in which disorders and how. So that's an example of how a systematic review works really well. And if this was an area that you were trying to do some research in, then we've done that already. We've put together all that information and we've come up with the answer for you. And there should be nothing that is missing from that literature base because of the way that we did the systematic search to get to that endpoint. So just a little bit about how systematic reviews differ from traditional reviews. So a traditional review is more like an opinion piece. This is where a researcher is asked to write a review of all of the relevant literature in a particular area, and they're usually quite broad in scope. So it can be, for example, if I had been asked to write a narrative, a traditional review on that previous topic, I would have just been given free rein to write anything I want to on minor phytocannabinoids in neurological disorders. But the difference with traditional reviews is they don't have a protocol. So they don't have defined search terms and defined search strategies in order to come up with the literature that gets included in the final review. And so that means that they can be sometimes a bit selective of the evidence that's out there. It isn't necessarily a completely objective reflection of the evidence that's out there. In a systematic review, we can often do critical appraisal. So a part of a systematic review might be where we grade the quality of the evidence that comes from each of the studies that we find in our systematic review. And that's quite typically done when the systematic review is of randomized controlled trials. So they'll use something like the CASP checklist that we talked about in the last lecture to come up with a grading out of 10 for each of the studies that is included in the systematic review. But that kind of critical appraisal doesn't tend to happen in a traditional review. So you don't get a feel for the quality of the evidence as judged by the researchers who performed the review. And so in general, I would say that traditional reviews are quite a nice way to learn about a particular research area, and they're usually done by well-respected people in the field, but they're not always a very robust analysis of all of the literature that's out there. And sometimes in traditional reviews, people can cherry pick the data that they want to present in order to present a particular story rather than with a systematic review, you get a much more objective analysis of just what's out there with no judgment about the way the story is told. So meta-analysis is when you've done a systematic review, but then you want to add in a level of statistical analysis on top of that to see if you can add the data from each of the studies that you found and put them together to have basically a greater strength in numbers. And in terms of the hierarchy of evidence, what we're generally talking about is people doing a statistical analysis that combines the results of multiple randomized controlled trials. So then you can add together the data from lots of different studies and basically say in this overall number of patients, this is what we think the answer is statistically as to whether or not a drug is effective or not. And that's really the pinnacle of the hierarchy of evidence triangle, because if you've done a meta-analysis of multiple randomized controlled trials, then you are likely to have the most definitive answer as to whether or not a medicine works. So what it does require, though, is that you have multiple studies that are addressing the same question, so studying the same medicine in the same disorder with the similar type of patient population, and also that you are measuring similar outcomes or endpoints, because you need to be able to compare apples with apples. And that's when meta-analysis works best, is when all of the studies have got the same primary endpoint. So an example would be with Epidiolex. There are multiple studies now where Epidiolex has been tested to cause a reduction in seizures. So that reduction in seizure is the primary endpoint that is consistent across multiple studies, which means that we can do a meta-analysis of that data and add it all together. So as I've mentioned, the thing that makes meta-analysis really effective is that you've got much higher statistical power because you have greater patient numbers, and the greater the patient numbers you have, the more confidence you can have to say that a medicine works. So this is an example of a meta-analysis that's been done with Epidiolex, which is purified cannabidiol, and it looked at 4 randomized controlled trials that were carried out in this 2 rare forms of epilepsy in which Epidiolex has been tested. And these are drug-resistant childhood epilepsies. And so they were able to combine all the data together to look at various outcomes, and they were able to show that when you added all the data together, that CBD was more effective than placebo in reducing seizure. Now, something else that this study was trying to look at was whether or not the effectiveness of cannabidiol was just because of its drug interactions with another anti-epileptic drug called clobazam. Now, this is one of the theories with cannabidiol, is actually that it isn't effective by itself, but just inhibits the metabolism of this other anti-epileptic drug. And so the reason it works is through the other anti-epileptic drug. But what this meta-analysis was able to show across these 4 trials was that actually CBD was still effective regardless of whether or not the patients were also on this other anti-epileptic drug. So they were able to show that the effects of cannabidiol were independent from this other medication. So effectively that CBD works by itself as well as working well in combination with this anti-epileptic drug. So that was a really useful thing that they were able to do in this meta-analysis because they had strength in numbers. They had multiple patients to analyze. Something else that they were able to do through the meta-analysis with this kind of greater strength of numbers was to look at adverse events, so the side effect profile of CBD, and they found that the side effect profile in terms of the sleepiness, rash, risk of pneumonia, and aggression were more common in patients who had been using this other anti-epileptic drug at the same time. And so those particular adverse events are probably due to interactions between the 2 drugs and may actually be related to a side effect profile of the anti-epileptic drug rather than of CBD itself. So this just gives you an example of how a meta-analysis can allow you to determine the effectiveness of a drug in a much bigger population when you compare multiple trials that have been carried out the same way, but also how it allows you to look at more factors relating to the effectiveness and side effects of a particular drug, because you've got much bigger patient numbers, and so things which are more rare can come out in great numbers. So during the course of the module, I'm going to apply this hierarchy of scientific evidence to what we know about how effective cannabis-based medicines are in different disorders. And so each disorder that I cover, I'm going to come back to this triangle and say where I think we are in terms of the current scientific and medical literature relating to the effectiveness of a particular compound in that disorder. So to give you an example, at the moment, at the top of the triangle in terms of having meta-analysis of multiple randomized controlled trials, we have very good confidence that purified CBD is effective in epilepsy. And we also have very good confidence that pure THC is effective at reducing the nausea associated with chemotherapy. So that is the top of the triangle. And then there are other areas that we really are quite at the bottom at. We're really at the beginning of the story, if you want to put a more positive slant on it. So an example of that would be, is cannabidiol effective in attention deficit hyperactive disorder, so ADHD? So that's something where we're still really at the beginning. We're really at the level just of case reports and case series and some animal data that suggests that there could be a potential role for CBD in modulating some of the behavioural symptoms with ADHD. And then there are other areas like the effectiveness of cannabinoids, so both THC and CBD and or their combination could be effective in areas like post-traumatic stress disorder, PTSD. And for areas like that, we're just kind of at the beginning of the randomized controlled trial kind of phase of research. So if we think of this, we can think of this triangle also like the drug discovery pipeline. We're kind of just at that beginning of the kind of phase 2, phase 3 work trying to prove that cannabinoids are effective at symptom management in PTSD. So as I've said, this will be covered throughout the module. I'll try and give you an indication about where I think we are for a particular drug in a particular disorder at the moment, and also a little bit about what the future lies, what's out there, what active trials are ongoing that might be adding to that triangle, and this space might look quite different in a couple of years' time. So just to conclude on this lecture, all evidence is not created equally. There is a hierarchy of evidence, but it all forms part of the jigsaw. I'm not saying that the bottom part of the hierarchy of evidence is unimportant, but it's really the foundation. It's the building block of our research. And then we build on that to do more refined randomized controlled trials and hopefully meta-analyses of those randomized controlled trials to get a definitive answer about whether a medicine is effective in a disorder, whether that data is reproducible and robust, coming from multiple trials and researchers across the globe to really tell us definitively whether or not there's a role for that medicine in that disorder. And systematic reviews and meta-analysis are really your friends when you're trying to look at the evidence base for any medicine in a new area, because it gives you the most objective evidence of whether or not something is going to work. And systematic reviews can be really useful at looking at different types of evidence. It can be preclinical as well as clinical. Meta-analyses tends to be more synthesizing clinical data. So hopefully now this will be useful going forward in the rest of the module, because I'm going to be coming back to this hierarchy of evidence concept and we'll be using it to try and judge the strength of evidence that cannabis and cannabis-based medicines are useful across a variety of disorders.